Okay, thank you very much for being here. I'm also very happy to participate to this big IMCAS 2025 Congress. I've heard that there were more than 20,000 people here during this weekend, and I'm very happy to be here. So my topic today will be to give you some information and some keys just to find out what would be the best thread to use for your practice. And the main question will be, would you choose any resorbable product, or would you prefer some permanent one? So first of all, a few words about aging and facial aging, and then we will go to choose between absorbable and permanent implantation methods and clinical results, of course. Now, when you speak about facial aging, all of you are plastic surgeons or aesthetic doctors, so you know very well the aging process, but you have a big range of choice, a big range of treatments to propose to your customers. But globally, you can consider aging as a global evolution. Global evolution, which will be in three main points. The first one is skin structure modification, and for that you will privilege in your treatments some skin care. Loss of volume, of course, and the idea would be to give more volume to the face of the patients. And the third phenomenon is ptosis, is the phenomenon of sagging of the tissues to go down. And for that, you just have two options, which will be surgical lifting and surgical lifting or thread lifting. Regarding the lifting, you have the choice between surgical lifting and thread lifting. And when you speak about threads, this is our today's topic, you have also the choice between permanent thread or resorbable threads. So the question will be surgery or threads. Where shall I go? Shall I go to surgery or shall I privilege the threads? And you can see that the thread lifting is considered as a non-invasive lifting. It's a soft surgery, so it's, I would say, easier, quicker, cheaper to do than surgery, but only adapted to a certain part of patients, which will present, I would say, mild to moderate sagging. Regarding thread lifting, you have also two options. First option will be to choose resorbable threads, or second option is to choose the permanent threads. Resorbable threads would be much more for rejuvenation, for young people, for people who don't need a real suspension of the tissues. The effect is much shorter, and you have to use a lot of threads if you want to get any results. We call that bio-rejuvenation threads. In the opposite, you have those permanent threads who can be considered as an alternative of surgical lifting in certain cases. Regarding the action of suspension threads, two things which are very important is to see that the action is much more vertical than the surgical lifting, and also that it is a reorganization of the tissue along the threads. Advantage of thread lift, most of you knows them. It is less scarce, less invasive, much cheaper, much more versatile, because you can do a lot of things with those type of threads. And to me, it's a good alternative to surgical lifting for certain cases. After that, you have the market, and the market is big, and you have a lot of products. And so, how to segmentate the market? Shall we segment? Is it barbed threads, tensing threads, rejuvenation threads, lifting threads, suspension threads? All of them are aesthetic threads. But you can segment it by type of users, by type of patients, by type of action, or by component. And if you speak about type of users, you will have cosmetologists, you will have aesthetic practitioners, cosmetic dermatologists or plastic surgeon. All of them will have different needs. But the main needs are, first of all, reliability, and second one, simplicity. The more simple you do, the easiest it will be. After that, you can also segment it by type of patient. Is it young? Is it older? How are the tissues? Are the tissues heavy or less heavy? The ptosis level, and also the budget. What is the budget they want to spend in their surgery? But the main needs of all patients are, first of all, security, and second of all, is long-term action. If you give them something which will last 6 months, that's not satisfying. You must give them something which will last much more long, okay? And after that, regarding this segmentation, you can speak about cosmetic threads or permanent threads, which are totally different by their type of action. Cosmetic threads are made of polydioxanone. They are mainly Koreans or Chinese. They are short and cheap, and they have quite quick degradation. They act mainly by overinflammation and by inflammation under the skin. After that, you see that type of threads. You have to put a lot of them if you want to get any results. And after that type of threads, there are some suspension threads and some lifting threads. Some of them are resorbable and some of them are permanent. So you will adapt your strategy regarding the need of your patient and the length of the results that you are looking for. In fact, I think that there is no bad product on the market. If you have good indication, realistic expectations, strong asepsia, good settings, whatever the product, and training, of course, whatever the product, if you make the right choices, you will have good success and good results. But anyway, no miracle. The objective criteria for choosing your threads will be the size. Is it long? Is it short? What do you need to treat your patient? Also, the construction of the filament. Is it multi-filament or monofilament? What is it done? Stiffness and flexibility. Flexibility is very important for the comfort of your patient and also for the comfort of the doctor. Resorption time, will it resorb quickly or not? And of course, surface characteristic, is it full of barbs or not? After that, knowing those differences with products, we developed this special thread called spring thread. And we started from the request of the patient. The patient were requesting security and long-term action. And the practitioner were requesting reliability and simplicity. So the result of that is the choice of the product, which is permanent, and we choose something elastic, just to be able to treat easily the lower part of the face, very strong to support heavy tissues, and I don't remember. With good fixation. Spring thread, we choose the silicone because the silicone gives the flexibility and elasticity. We made a polyester core just to have very good strength and to control the elasticity. We made molded cogs just to get it and to don't create some pain for the patient. And of course, it's permanent for long-term action. Regarding implantation, it's very easy to do once you have the right patient selection. Patient selection is the key. Good psychological profile is very important. No important general disease. And usually it is the type of people who are too young for surgical lifting, who don't need surgical lifting, who don't want surgical lifting. The indication will be face oval, nasolabial, folds, marionette lines, cheek, eyebrows, mainly the face. The experience, very simple. Of course, patient-informed consent, skin cleaning, drawing, cleaning again, anesthesia. Then you go sterile. You make disinfection and drawing, insertion of the threads. Very important, the settings, and before, after recommendation and pictures. Of course, asepsia is very important. And regarding anatomic, there is no risk because it's in the subcutaneous fat and not deeper than that. The laying, to us, the more simple, the better it is. So we privilege the straight laying to enter in the temporal area, one part to be up and to be fixation point, and second part to go down to be a reorganization point. Pre-care and post-care, preventive antibiotic treatment if necessary, no massage, sleep on the back, soft cleaning from the bottom to the top, no bandage, no compression garments, no need, and sleep on the back if it's possible. Bad results and complication, matter of setting, matter of deepness of the thread, don't put it too superficially, but globally there is very, very few side effects. Some inflammation, mainly with resorbable thread, not with permanent threads. Infection, this must work clean just to avoid infection cases. And pain will be for a few days for the patients. So the strategy for success, talk with your experts, get trained, and experience by yourself. Choose the right indication. Don't put threads on too young people. Don't put threads on too heavy tissue. You will never get the result that you are waiting for. Be realistic on your expectations. Do not confuse cosmetic threads, which will give only rejuvenation, and suspension threads, which will really reorganize the tissues of your patient on a vertical way. Find, in any case, some fixation point. If you put floating threads, you will get floating results. So please try to get, in any case, fixation points. And also, please use the most simple procedure. And with experience, we see that the simpler are the procedure, the better are the results. If you spend 2 hours just to introduce some threads, that's not good. Just do it quickly and do it with very simple procedure. In terms of results, I will present you very quickly because my time is counted. Only a few results. For example, you have this case coming from Chile, from Dr. Vicente de Carolis, and you see that it's really spectacular on the lower jaw, but also on the neck. Result coming from France, from Dr. Perrault, which is also quite spectacular. And coming from UK, we have Dr. Qureshi. He's in Glasgow, and he has very, very nice results. This is only threads and only straight laying. So you see that the result is really spectacular, even long time after implantation. This is from Russia. And again, on a quite heavy face from France. Next example will be this one. This patient did 3 things. First thing, she had threads. Then she stopped smoking. And after that, she had peeling. And you see that it's really, really spectacular. Another example from Mr. Guillot was very, very nice results. And also, you see that it works very well on Asian faces. And the last picture I wanted to show you, it is this one. which shows the result 2 months after and the result 5 years after. And you see that 5 years after, and after the second set of threads, it's even better than she had before. So there is a real useful face done by the thread. So yes, thread lifting is the future of the facelifting because it's quick and easy. It's a real complement to the other techniques. But pay attention, choose the good indication, choose anchorage points, use an elastic thread, stay on the natural side, and do not look for miracles. Please do not look for miracles. Thank you very much, and you can come very close to here to our booth. Thank you so much for your time. Thank you.